We had lost Chesna by the time I was 19. And so in my mind, you just got pregnant and you had a baby and that was it. And this taught me to be grateful for every moment and to never take anything for granted.
How can a family deal with the loss of a child? What happens when a surviving child needs a transplant? What advice does a longtime heart mom have for other heart families? Welcome to Heart to Heart with Anna. I am Anna Jaworski and your host. I'm also a heart mom to an adult who was born with a single ventricle heart and who is 28 years old. That is the reason I am the host of this program. Today's episode is called Families with CHDs Dealing with Mental Health Issues. I always enjoy meeting fans of the show. When I received a letter from Bridgett about how much she enjoyed the program I did with my dear friend Helen Simpson entitled The Mental Health of a Heart Mom, I was so happy. That episode was the #1 episode of 2021, and I believe it's a topic that resonated with so many people, and that's why it seems like 2022 has been filled with a record number of programs dealing with mental health issues. Bridgett Streacker has been married to her husband, Brian, for 34 years. They have 4 children, Jacob, who's 33, Chesna, who is stillborn, Mallory, their heart warrior, and Haleigh, who's 24. As a family, they have gone through many, many surgeries and obstacles, heartbreak and triumphs, which have made them closer. Bridgett describes her heart warrior as one of a kind who never let her CHD define her and lives like there is no tomorrow. The family faced one of its biggest challenges during COVID when Mallory had a heart transplant and was allowed no visitors for her entire hospital stay. Today, Bridgett and I will be discussing what it's like to be a CHD family, how we deal with mental health issues, and some advice for other families facing situations such as the ones we've faced. Welcome to Heart with Anna, Bridgett.
Thank you for having me. I'm so excited.
I'm excited too. I always love talking to other heart moms. So let's get started by having you tell us a little bit more about your family. Dealing with CHD, transplant, and multiple procedures is hard enough, but you also dealt with having a baby who was stillborn. So let's talk about some of these major traumas that your family has had to deal with.
Sure. Well, our daughter that was stillborn was our second born, and our oldest was only 18 months at the time. So her death didn't really affect our other children, but it obviously affected my husband and I. And I honestly feel very peaceful about that. I've always known that she was not meant to live on this earth, but what it did do is make us all the more aware of how much of a miracle it is when you do have a healthy baby. And so getting pregnant again with our heart warrior was a totally different experience for us as a husband and wife. And of course, her being born with a major heart problem sent us for a whirlwind. So it did affect us. I'm not going to say it didn't, but I can't necessarily say that losing Chesna affected my other children. They've always known that they had a baby sister that passed away, but that was about it.
So I'm wondering, do you wonder if Chesna had a heart defect?
We do. We did have genetic testing done before we got pregnant again. And they assured us that it was just a fluke. She had something called Turner syndrome, which is kind of the opposite of Down syndrome. With Down syndrome, you have an extra chromosome. With Turner syndrome, you're missing a chromosome. And she had other complications as well. But they assured us it was a fluke. It was not genetic.
But Turner syndrome children, and they're all girls, that is part of the genetic composition. Yep. Many of them do have a heart defect.
They do. And we're learning that now. You know, this was 32 years ago.
Right.
So we are learning that there could be there could have been a correlation between the two. And it's not something that we've really delved into. And I briefly talked with my husband after learning this and saying, don't you think our kids should all be tested before they have children? And he said the most awesome thing to me. He said, honey, if we would have known before, there would never have been a Mallory or a Haleigh. So I think that's something that you just need to let God handle.
Yeah, just because you have a predisposition doesn't necessarily mean that's going to happen. And I agree with your husband.
Right.
I would love to meet your husband. That's a very profound and sweet thing to say.
Yeah. He's an awesome guy. He really is.
Sounds like it. So your younger children didn't know about Chesna, but Jacob was old enough that he knew mommy was pregnant and knew mommy had to go to the hospital. Was he talking? And did he ask about baby sister?
He was talking. He was an early talker, but at 18 months, I don't know that he really grasped or understood. I know that he picked up on mommy and daddy being sad. And I've always said that I was so grateful that we had him because he was my reason to go on. He was my reason to not lay in bed all day. Sure. And I knew that I still needed to be a mom. And we worked through everything as a couple. We worked through the pain and we relied a lot on our faith. I can honestly say it's when my faith was very much strengthened. I really learned what it meant to trust and to go on and move beyond it. I don't regret any of it. I've always said she taught me more in the 6 months that I carried her than I could have learned in a lifetime. And that can be said about so many things. I don't know that I would have been as calm as a mother, and I wasn't always. My children will attest to that. But I feel that I had an appreciation for motherhood. I was a young mom. My husband and I got married right out of high school. I was only 17 years old when Jacob was born. And so we had lost...
Very young mother.
Yeah. Yes. And we had lost Chesna by the time I was 19. And so in my mind, you just got pregnant and you had a baby and that was it. And this taught me to be grateful for every moment and to never take anything for granted. And I've always said that about both Chesna and Mallory. And when Haleigh was born, she was healthy. And my doctor came in and just said, Bridgett, I've looked and I can't find anything wrong with her. So even my doctor was so thrilled for us. And we just appreciate everything. We truly did. We were older when Haleigh was born. There were 7 years between the girls. And I knew that this was our last baby. And I just truly treasured every moment. And I don't know that that's something that I would have known to do had we just had all healthy children.
Home Tonight Forever by the Baby Blue Sound Collective.
I think what I love so much about this CD is that some of the songs were inspired by the patients.
Many listeners will understand many of the different songs and what they've been inspired by. Our new album will be available on iTunes, Amazon.com, Spotify.
I love the fact that the proceeds from this CD are actually going to help those with congenital heart defects.
Enjoy the music.
Home Tonight Forever.
This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The opinions expressed in the podcast are not those of Hearts Unite the Globe, but of the hosts and guests, and are intended to spark discussion about issues pertaining to congenital heart disease or bereavement.
You are listening to Heart with Anna. If you have a question or comment that you would like addressed on our show, please send an email to Anna Jaworski at anna@hearttoheartwithanna.com. That's anna@hearttoheartwithanna.com. Now, back to Heart with Anna.
Bridgett, you alluded to the fact that you've had quite a journey with Mallory in the first segment, but we really don't know a whole lot about what you went through with her. I'm assuming she doesn't have Turner syndrome, but can you tell us a little bit more about what her heart defect is and what her heart journey has been like for you?
Sure. So when she was born, they heard a murmur. They weren't all that concerned because a lot of babies are born with a murmur. But when she was 12 hours old, she turned blue and they did further testing. She was transferred to another hospital. We live in a very small town. And they found that she had Epstein's anomaly, which is a defect of the tricuspid valve. And along with that, she had ASD, atrial septal defect, which is the hole in the right atrium. So she spent the first week of her life in the ICU and the NICU, and she honestly did great. They gave her some medication to purposely keep that hole open that typically closes within the first few months of a baby's life. And they just kept weaning her off her medication, and she did great. They told us that it would be a journey. We were able to take her home on a heart monitor, and she did great, honestly, for the first 12 years of her life. She was pretty much asymptomatic. There were little things. When she would get cold, her lips would turn a little blue, things like that. But she lived a very normal life. In fact, she danced from the time she was 3 years old up until 12. So at 12 years old, I started to notice some things. And at this point in time, she was only being seen once a year by her cardiologist. And I called him and said, you know what? My mama heart is telling me something's off. She seems to be struggling endurance-wise with dance. I think her coloring's a little off. And he knew us well, and he kind of laughed and said, well, let's move her appointment up. I don't think we'll find anything, but we'll go ahead and move it up for you. And sure enough, that is when they did an echo and they said, okay, we have a big problem here. And from there, they referred us to the larger hospital in Michigan, Mott Children's in Ann Arbor, Michigan, who was her cardiologist from there on out, Dr. Albert Rocchini, wonderful man. And she ended up needing her first open heart surgery at 12. And I think if I could say anything about what I would love to be a continuation from this podcast and every podcast, is just preparing parents more for the mental aspect of what this entails, because there was not a single person that said to us, this is what you're going to go through. This is what she's going to go through. And they told us how they were going to fix it, but that was it. And they did. They did a valve repair. They tried to do a valve repair, a tricuspid valve repair, and they also closed her ASD. From there, a year later, they had to go back in and repatch her ASD. It had opened up again, and she had an Amplatzer device installed.
So were they able to do that? Right. They did that during the heart cath. So
Yes.
When she was an infant, she didn't have to have open heart surgery?
She did not. She did not. And they were more or less feeling as though she may be one of those that never needs anything done. And we always knew puberty would be kind of a test, because the concern was, will that defective valve keep up with the rest of her heart? And in fact, that's exactly what happened. She was my fast grower. Kind of one day she looked 16, and that is exactly when things took a turn for the worse. So they did that valve repair. They patched the ASD again, and she just never really recovered well from that. And it was the beginning of her mental journey as well as a physical journey, because she was 12 years old. She could no longer dance the way that she had always been able to. Her peers didn't know how to handle her. With heart patients, they look fine. That's the struggle. They look fine. And she did. But she couldn't keep up, and she didn't feel well, and everything was hard for her. And so consequently, a couple of years later at 15, found her back to her cardiologist and them recommending another surgery. And this time they wanted to try something called the bidirectional Glenn procedure.
Okay.
And that bought her a good 5 to 6 years. Now, she will argue and say she wishes she wouldn't have had it, because there were some side effects to it. Her blood offload upwards. So she suffered from the bidirectional Glenn procedure with migraine headaches and just feeling a lot of pressure in her upper body and her head. So she never felt good after that. But it did buy her years of being able to live a semi-normal life, which we all know is difficult for our heart patients.
So this happened when she was 15. Was she able to go to high school like her peers, or did you have to keep her home?
She was able to go to high school sporadically. Okay. She never had a year in high school where she wasn't pulled out for some type of medical procedure, surgery, migraine headaches, things like that. So she did not have a normal high school life. And consequently, she suffered. She was a very good student, got really good grades, but at the same time, her teachers did not, how do I want to put it? They didn't want to push her the way they pushed other students. So they kind of set her up for failure for college, because she got to college and did not feel prepared. because she always had home tutors, and there were a lot of teachers that said, well, she can just do this part. Don't worry about this part type of thing. And I know they meant well.
Did she have an IEP?
No, she had a tutor. And again, we're from a very small town.
Okay. So she wasn't in special education. She didn't have special adaptations. These were just the teachers trying to be compassionate and loving and understanding that she had a special condition. So they kind of babied her a little bit.
They absolutely did. They absolutely did. And again, she got to college and just felt completely incompetent. And at the same time, you know how it is with our little heart warriors. She was home so much that she really didn't have a social life. Her peers didn't understand her. She struggled a lot with her peers in everything, in dance and in school, because they just didn't understand. They couldn't possibly comprehend what she was going through. And so I was her friend. I was her mom. I was the person that was with her all the time. And she went to college and didn't have any of that. So she came home after a year, and that's okay. That's okay. She tried, but she just never really fully recovered from either of those surgeries. And like I said, we had a good 5 to 6 years. And then when she was in her early 20s, she started really struggling mostly with arrhythmia issues. So she was either an atrial flutter or she was an a-fib. So many ablations, cardiac conversions, all of those things, lots of trips to the ER, lots of scary episodes.
Traumatic.
It was very traumatic for all of us, because there was one particular time with my youngest daughter where Mallory called me. She was working and said, I think I'm an atrial flutter. I don't feel good. And I said, you need to call 911. And she passed out at work, and a coworker had to take her to the hospital. And my youngest daughter was closer at the time than I was. I was in another city, about an hour away. So I had to call her and say, can you please meet them at the ER until I get there? And this was the first time they had to give Mallory I can't remember the name of the medication, but her heart rate was so high that they needed to slow it down. And she thought she was dying, and they didn't warn her that she would feel that way. And so she thought she was dying, and she says to my other daughter, I'm not going to make it. And so she had to witness that. It was terrible. It was terrible. And by the time I got there, they were transferring her back up to Ann Arbor to do a cardioversion. So there were so many of those I couldn't even count. There was one time when she moved, I think when she was about 24, she moved to Cleveland, Ohio, which is where she has had everything since, at the Cleveland Clinic. And she had called us saying she was an atrial flutter, and she called 911, and they came to get her. And we get in the car and we're driving to Cleveland, which is a 2-hour drive for us. And we had no idea what hospital they were taking her to. And we couldn't get a hold of her. We couldn't get a hold of anyone. We just had to guess. So we showed up at the Cleveland Clinic ER in hopes that she was there. And she was. Yeah, many traumatic events, many times. I had a therapist ask me one time, how many times have you either watched or thought your daughter was dying? And I can't even count them. I can't even count the number of times that I've seen doctors running down the hallway with the paddles and kicking us out of rooms. And there was one time during a hospital stay that her heart rate kicked up into the 300s, and they had to shock her twice.
Wow.
And seeing the fear on her face and thinking, this is it. This is when I'm going to see her die. It's just not something that you can ever describe to anybody who hasn't been there. And our friends and family are wonderful. They are. They're so supportive. I don't know what we would do without them, but there's so many things that they could just never comprehend unless you've been there.
Yeah. Plus, how many times do you tell them, knowing that you're going to traumatize them every single time you say it too? I don't know about you, Bridgett, but I found myself censoring what I was telling certain family members because it would upset them so much.
What we ended up doing, and it was actually my oldest son's idea, during her first surgery, he was 15 and he desperately needed, I think, something to occupy him. So he started the care page that all the hospitals have now.
Mm-hmm.
And we were able to update that. And I kind of go into this, I don't have the emotional energy to update everybody. So I update the care page and I tell our closest friends and family that this is how I'm going to communicate. This is the easiest way for us to let everybody know what's going on. I know you're all worried. I know you're all wanting updates, but for me to be on my phone, calling or texting or updating during these hospital stays is just more than I can handle. And so that's what we did. And I do a pretty good job of keeping at least our parents and immediate people, but it's a lot. It's a lot to handle. And I know everybody means well and everybody loves her and supports us, but you almost have to put down those barriers and just do what you know is best for yourself and your children.
Anna Jaworski has written several books to empower the congenital heart defect or CHD community. These books can be found at Amazon.com or at her website, www.babyheartspress.com. Her bestseller is The Heart of a Mother, an anthology of stories written by women for women in the CHD community. Anna's other books, My Brother Needs an Operation, The Heart of a Father, and Hypoplastic Left Heart Syndrome, a handbook for parents, will help you understand that you are not alone. Visit babyheartspress.com to find out more.
Heart to Heart with Anna is a presentation of Hearts Unite the Globe and is part of the Hug Podcast Network. Hearts Unite the Globe is a non-profit organization devoted to providing resources to the congenital heart defect community to uplift, empower, and enrich the lives of our community members. If you would like access to free resources pertaining to the CHD community, please visit our website at www.congenitalheartdefects.com for information about CHD, the hospitals that treat children with CHD, summer camps for CHD survivors, and much, much more.
Bridgett, in the second segment, we were talking about all of the different medical trauma that Mallory has experienced, but it gets worse. Mm-hmm. So tell me what happened even after the atrial flutter and the a-fib and all of the different cardiac conversions she had. It wasn't enough, was it?
It wasn't. So in May of 2019, her heart failure doctor gave her 1 year to live without transplant. And at this point in time, Mallory was going through a horrible divorce because, as we all know, it's difficult to maintain relationships when so much is going on. So she was going through a divorce. She did not want a transplant. In her mind, this was it. She was going to live the rest of her life as well as she could, and she didn't want any part of it. Wow. And so because she wasn't mentally prepared, they decided to try another open heart surgery where they were going to give her a pig valve. And that was in November of 2019. And that was a real turning point for all of us because she's now an adult, which means it was on her terms. And I was not privy to any information that she did not want me to have. And Mallory was very good at keeping a lot of that to herself. And I think it's because she didn't have the mental capacity to deal with everything emotionally on her own, let alone take on everybody else's emotions. And she said that to me. She just couldn't handle my emotions or her family's emotions. So that surgery was, like I said, in November. It was after Thanksgiving and we were all there and I stayed with her for that whole week. And it was eye-opening in many, many ways because for so many years, I think she kept fighting and fighting and fighting for her dad and I. And she had said to me that recovery was brutal. She was now an adult. She was in so much pain. Her pain was not being managed. She really struggled. And I remember so clearly just holding her and her saying to me, I can't do this anymore. And I said to her, honey, you don't have to. I am here to support whatever you need, but you don't have to do this for me. And I remember having a conversation with my husband. We have to stop pushing her if this is what she wants. And she also said to me at one point, do you know how a cancer patient feels, Mom, when they're just done with chemo and they can't fight anymore? She said, that's how I feel. And it was the hardest thing as a mom. It was so hard because I knew in my heart that I couldn't ask this of her anymore. And I had to accept whatever was going to happen. And then we fast forward, and it was a very difficult year to 2 years of just between her divorce and the heart failure and how horrible she felt and all of those things. She did end up getting on board with transplant. And we met a wonderful man that lived in our town who had had a heart transplant at Cleveland Clinic. And he sat down and talked with her, and I owe so much to him. And he said to her, Mallory, I promise you that even your worst day after transplant is still going to be better than your best day now. And
really,
and she got on board and she did the work. And when I say she did the work, most people don't realize the heart transplant process or any organ transplant process is so unbelievably long. It is not a matter of just getting on the list. Right. You have to go through counseling, and they need to make sure that you are mentally ready and all of those different things. And she did the work, and I was so proud of her for it.
Was this the first time that she had counseling where she was really addressing her heart issues?
No, but was it the first time that she was doing it without Mom forcing her to go to counseling? Yes. So, I'm a believer in therapy, and I tried from the time she was 12 years old, but she just wasn't having it. She would go because I made her, but that doesn't work. She needed to be her own person. First time it was on her terms and her decision, which it needed to be.
It needed to be. It did. Okay. So she decides, I'm going to do this. Life is worth living. Mm-hmm. And what happened next?
It was a long process. Again, like I said, between the transplant board and when to list her and perfect timing and everything. So she had a heart cath in February of 2021. And that revealed that it was time for her to be hospitalized. It was time. She was very sick. Her heart function was not good at all. And they let me know afterwards, we would like to admit her actually right now, get her on some intravenous meds. But Mallory's birthday is in February. She was turning 30 on the 15th. And she just told her doctors, I'm not spending my 30th birthday in the hospital. So they decided to let her go home and give it, I believe it was another 10 days until her birthday. And she was admitted on the 17th of February. And they started the intravenous meds. And that was another roller coaster because she feels that she was led to believe we're going to start these meds and you're going to move high on the list and get a transplant. And she was prepared to live in the hospital for months and months. Mm-hmm. But a few days later, her team came to her and said, listen, because of your bidirectional Glenn, because of your implanter device, because of all these different things, we're not sure that we would have time to do it all in one surgery when it comes time for transplant. So we think that we need to go in there and install the RVAD, which is the right ventricle heart pump, and kind of pave the way, undo the Glenn, all of these different things, and pave the way so that for transplant it will be successful.
Oh, wow. I've never heard of this happening before. So they were going to take down the bidirectional Glenn?
Yes, they wanted to take down the Glenn, and they wanted to give her this right side heart pump. And the left ventricle, you can get an LVAD and you can go home and live with that for quite a few years.
Right. I've had people on my program talk about that, but I've never heard anybody getting an RVAD. Okay.
So the RVAD is different. The RVAD is huge. When you get an RVAD, you are not leaving the hospital. And so she knew that. And she called us that night and said, I'm coming home. I'm done. I'm coming home. I'm not doing this. This is not what they told me I would be doing. I feel misled. And her fear, of course, was living the rest of her life in the hospital on an RVAD because nobody could guarantee her a new heart.
Yeah.
And she had a wonderful team, thank God. And again, this was during COVID. We had to do all of this during FaceTime, during phone calls. But her team came into her room. They had us on video call and basically said to her, what can we do? Tell us what you need. Why are you refusing to do this? And after a long talk with all of us, they assured her that she was getting a transplant. They kept telling her that you are getting a transplant, you are getting a heart. And I believe that they already knew because her organ donor was actually on life support, is what we found out. So I think maybe they knew, but they couldn't say.
Okay, so they wanted to give her the RVAD as a bridge to transplant just so that her heart would not become even weaker before the heart could be harvested. Wow. Okay.
That's just my theory. I'm not positive on that. That is just my theory. So
Mom's
on March the 1st, on March the 1st of 2021, she had her RVAD surgery. That surgery went quicker than they thought. She recovered pretty well. We had some funny conversations. And I remember her saying to me, and you have to remember when they're on all of these drugs, sometimes the funny parts of the conversations are just comical. But she said, Mom, I think I'm going to get a new heart really soon. And I said, well, I really hope so, honey. And she goes, but I hope it's not too soon because I'm really tired. And we just laughed at that because here she is like 12 hours out of surgery and she's talking about that. Well, lo and behold, 3 days later, she got a new heart. And so,
oh my gosh.
it was that quick. So she had the RVAD surgery on March the 1st. She got the call. They came into her room. Actually, she called us at 7:30 on March the 3rd and said, are you guys sitting down? I have a new heart. And the world just dropped, and we had always envisioned that it would be this quick thing. We had hospital bags packed because we knew even though we couldn't be there, we were going to be as close as we could. But because her donor was on life support, it wasn't a right now thing. So her surgery was actually at 4:30 the next day. And so the way we handled that as a family is we all drove to Cleveland and we stood outside of the hospital and we wore our Heart Warrior t-shirts and we recorded messages for her and we sent the videos to her and we all stayed together in an Airbnb so that we could be as close as we possibly could and so that she would know that we were as close as we possibly could because this was very, very hard on her. And she's a very, very strong woman, but at the end of the day, she needs her family during these times and she had to do it by herself. And it was just heartbreaking for all of us.
Yeah.
But we got as close as we could and we were all together and we went to the hospital that morning and recorded our video and sent it to her. And then we all went back to the Airbnb and waited together as a family. And they called us. The surgeon actually called to update us. And it's one of those moments that you'll never forget. But it was 10:30 and we got that call and I put him on speaker and he said, we have a beautiful beating heart. And
wow.
Just the emotions, the relief, all of that was just something that you can never describe. Yeah. And it was a wonderful, wonderful moment. She does have a pacemaker. Her new heart was beating very, very slow and it wasn't waking up and they did have to put a pacemaker on. And so there were some ups and downs as there always is through the recovery. I always say that surgery itself is just the beginning. It's the road to recovery that is the emotional roller coaster. And every time we've gone through it, when the first thing hits, my husband and I always say, oh, that's right. This is how it goes. We're going to be up and down and up and down and up and down. And that's difficult. That's harder, honestly, than the waiting the day of.
Really? So you think the recovery with this uncertainty and it's got to take a while for a body to recover from a surgery that major. My heart warrior was 17 when he had his last revision. And he told me it took him over a year before he really felt that he had completely recovered. And that wasn't a transplant.
There's nothing that can prepare you for seeing your child right after. Every single time it brings me to my knees. And we talk about mental health. And for me, that part of it is very difficult. Walking into that ICU that first time and seeing her unresponsive or just full of fluid and hooked up to so many different things. It's not something that you can ever prepare yourself for. And for me, it was a shock to the system every single time. Even though I knew, it was still a shock and difficult because you feel so helpless. And
you do.
She struggled so much. Yes. She had the breathing tube, and she would look at us and want to talk and not be able to talk. And then you would just see these tears coming out of her face, and she would, be hand motioning, and it's just excruciating. It's excruciating to watch for all of us, for her siblings, for her dad and I.
So even though it was during COVID, they did allow you to go up to the ICU to visit with her?
No, we weren't. From the time she was admitted until the time she came home from transplant, it was strictly FaceTime videos and phone calls. I will say that the nursing staff was phenomenal, and it was so sweet. The day of her transplant, so as soon as they took the breathing tube out, she said to her nurse, "Can you FaceTime my parents, because they're going to want to know this?" And so she did. And we got to see her. They were great. We could call up to that nurse's station anytime, day or night, and ask questions, check on how she was doing. If she wasn't able to hold the phone, they would hold it to her ear for them. They would hold the iPad so that we could see her. They were phenomenal.
So this has been quite a roller coaster ride. We're over a year past her transplant. How is she doing now?
She's doing very, very well. Physically, she's never felt better. She loves to go to the gym. Her passion is working out and weightlifting. She's actually training to do a competition and works with a trainer, and that has become her new passion. And she does unbelievably well. She feels great. She still says, "Mom, there's things that are never going to be normal for me. I still don't function at full capacity, and I still get tired, and I still have days where I need to be at bed," especially if she's done a lot the day before. But overall, she's never felt better in her life. Mentally, she is very much struggling. And it's been an up and down journey. And she's going to start some pretty intensive therapy for PTSD. And I'm so proud of her for that, because it's her decision and it's something she knows she needs. But so many people think that transplant is this magic cure. And people don't realize transplant is a treatment. It is not a cure. It's a treatment when all else fails. For instance, she takes so much medication every single day of her life that she will always have to take. And all of those medications have their own side effects. So you're treating one thing for another. And for instance, she's had problems with her teeth, had to have deep teeth cleanings and things like that, just from the prednisone and the high levels of steroids that she's had to take. So there are definitely issues, but I look at it as a miracle. Some days she feels that way. Other days she doesn't. There's definitely times where she has regretted it. And I think those are her lowest times.
Sure.
She has told us in no uncertain terms, "This is it. I will never have another transplant. I will never, even if it's another organ, I will never do this again." And we respect that. We respect that. We remind ourselves that there was a time she wasn't willing to do it at all anyway. But I think for all of us as a family, we've had to learn to respect her wishes and not push what we want on her, because obviously if we had a choice, we'd want her with us forever. And it's difficult. I think one of the biggest struggles as a family is learning to be able to celebrate during times when she's been at her lowest. So my youngest daughter got married during her late stage heart failure. And we were planning a wedding knowing that she could be admitted or get that phone call at any time. And it was very hard to be able to celebrate one child and not the other. And my son would say to me, "Mom, it's okay. And you're allowed to be happy. You're allowed to celebrate these times." But it's challenging. It's very challenging. And
so what advice would you give a family that's dealing with this? Because you're right. It's got to be a huge challenge to celebrate joy with your healthy children while you're grieving the problems that your heart-challenged child is dealing with.
I think the best advice I could give is allow yourself to mourn the life that you had envisioned for your child, because no parent envisions their child having to suffer their entire life. Watching her suffer has been undescribable pain, wondering if there will ever be an end to it, wanting her to have complete happiness, but not knowing if she will. that's difficult. So you almost need to mourn that loss. And I think all parents of chronically ill children or handicapped children all have to go through that. But at the same time, knowing that your other two children are going to have all of these things that maybe your chronically ill child won't have. And it's okay to be happy for them. It's okay to celebrate them. It's okay to be proud of them. And I'm so proud of all of my kids for different reasons. But it is difficult to kind of
compartmentalize. I was just going to ask you.
There we go.
Do you have to,
Yes.
It's almost like you have to compartmentalize me as a mom to Jacob, me as a mom to Chesna, me as a mom to Mallory, me as a mom to Haleigh. And the mom to Haleigh is allowed to be so excited that she's getting married and to want to be there fully for her, while the mom to Mallory still needs to be fully there for her. And that's a mom who is mourning.
Yes.
Wouldn't it be lovely if we could just clone ourselves so there's those separate moms
for sure.
could actually 100% be there? But I think that's what makes it so hard, don't you, Bridgett? That you want to be there fully for each child, but there's a part of our mind that is with every child, not to mention your husband and other people in your life. But it seems to me what would be so challenging is trying to be there so fully for each child and allowing your heart to feel the joy fully for one child while still grieving the losses for another.
Absolutely. And I didn't do it well all of the time. I was in survival mode for many, many years. And I know that I was not fully present for my other kids. And I know that they suffered. My youngest daughter suffers from anxiety, which I know is based on and started when she was 5 years old, when Mallory was first admitted. We left home thinking we'd be home in a week. We were gone a month. And she was young and didn't understand. And many of the traumas throughout Haleigh's young life, she was old enough to know something was going on, but not old enough to fully understand it. And she suffers from anxiety as an adult. And my oldest son had way too much responsibility on him at a young age. And
well, it's funny because you were saying, he said to you, it's okay, Mom, you can experience this joy. It's almost like he became a parent to you, that he felt responsible to be the one guiding you when you were going through some low times.
He absolutely did. And it's something that I really work with now. He is my gentle, sweet, calming soul. He always knows the right thing to say. He's very, very sensitive and intuitive. And so I would find myself calling him with all of these struggles I was having and letting him talk me through it. And I'm trying really hard to not do that anymore because I don't want him to feel that burden. I want to have a relationship with him that is outside of how do I handle this situation.
So I've got to know what profession he works in. Did he go into a medical profession?
Well, it's funny because his college degree is psychology. However, that's not what he ended up doing. He works in an IT field. He's my techie guy. So he works for a company that is IT. So he's not doing anything with his degree. But I always tell him he did many internships with his family.
Those degrees are never wasted. And it's amazing how they can infiltrate different aspects of your life. Well, Bridgett, we're out of time.
Right.
How did this happen so fast?
Surprise, surprise, right?
It did go super fast, but I'm so happy to hear that Mallory did get her heart and that she is working through her issues and she hasn't given up on life.
She hasn't. She's a true warrior. I know we use that term a lot, but she truly is.
Well, thank you so much for coming on the program today, Bridgett, and sharing your experiences and advice with us.
Thank you for having me.
That does conclude this episode of Heart to Heart with Anna. Thanks for listening today. Please consider becoming a patron of our program by visiting patreon.com/heart to heart. And remember, my friends, you are not alone.
Thank you again for joining us this week. We hope you have become inspired and empowered to become an advocate for the congenital heart community. Heart to Heart with Anna with your host, Anna Jaworski, can be heard at any time wherever you get your podcasts. A new episode is released every Tuesday from noon Eastern Time.